Hello, in this module, I would like to introduce to you the research that we have done on Chanwuyi Lifestyle Medicine. Since I am a clinical neuropsychologist, my primary interest is to see if Chanwuyi Lifestyle Medicine can be a possible neuropsychological intervention. According to the UN report in 2007, nearly 1 in 6 of the world's population suffer from neurological disorders. The number is higher than a lot of people think. There are many neurological disorders affecting people at all ages. For instance, Alzheimer's disease, Parkinson's disease, stroke. Those are the problems affecting mostly the older adults. Psychiatric disorder, head injury, depressions affecting adults, autism, ADHD are developmental neurological disorders. People suffer from brain disorders have various kinds of cognitive problems. The most prominent one is losing memory. A lot of them has memory problem. They become inattentive, disinhibit, and also have some language problem. Some people also suffer from various kinds of psychological problems such as depression, being bad temper, being impulsive and anxious. However, most of the cognitive disorder cannot be treated effectively with medicine. So, I want to think about the problem from a different angle. Can Chanwuyi Lifestyle Medicines help to improve the cognitive and psychological problem of those patients? I hope to open a door for those who are suffering from those problems. So let me introduce to you the Chanwuyi Lifestyle Medicine program briefly. Chanwuyi Lifestyle Medicine program is an evidence-based program that has integrated the Western concept of lifestyle medicine and the Chinese medical concept. The Chanwuyi Lifestyle Medicine composed of 4 major components that are consistent with the domain suggested by the American College of Lifestyle Medicine, including whole food plant-based diet, regular, sufficient physical activities, stress management, and psychosocial well-being. The uniqueness of Chanwuyi Lifestyle Medicine is its component was developed based upon a Chinese Chan-based medical concept, Chanwuyi. Chanwuyi is originated from the unique Chinese culture that has developed more than thousands of years in Buddhism temple in China. It is a wisdom of living that was passed down from the Chinese ancestor to achieve a peaceful mind, healthy body, harmonic living. We have conducted research on Chanwuyi Lifestyle Medicine since 2007. The population that we have studied, including the children with autism, adults with depression, and older adults with memory problem. Our research suggests that they all show various levels of improvement on cognitive function, psychological status, and physical health. So first, let me tell you what we have found on autistic spectrum disorders. Autistic spectrum disorder is a childhood disorder. Children with ASD manifest various kinds of cognitive and behavioral problems. For instance, they prefer to play alone, they having problems to interact with others, and their behavior is relatively stubborn. One of the important cognitive functions that we have is cognitive flexibility. That is, the ability to transfer one concept to another, able to switch our thinking from one dimension to the other. These abilities allow us to adapt to the new environment and willing to change. A lot of children with ASD has cognitive inflexibilities. They are not willing to change. Therefore, they have a hard time to adapt to the changing environment. They like routine. They like consistency. Another cognitive function is inhibitory control. It's the ability to focus on relevant stimulation in the presence of irrelevant stimulation. We need to be able to control the impulsive response in order to make a more appropriate behavior. For instance, we control our temper outburst in a stressful situation is one of the examples of inhibitory control. Children with ASD have inhibitory control problem. They are not able to control their impulsive response. That's why it is one of the reasons for social inappropriateness of these children. In one of the studies that we published in 2012, we tried to understand if changing the diet of those children may help to improve their cognitive and behavioral problem. So, this is what we find. On the test of impulsivities, experimental group, which is the children has changed their diet, saw a 37% improvement while the control group saw only 3%. So changing the diet of the children helped to reduce their impulsive behavior. Children who have changed their diet showed 62% improvement in mental flexibility from the baseline, and those in the control saw only 4%. So this study suggesting that a short period of time of changing diets has already shown a very positive effect on children who has behavioral and cognitive problem. In next study, we interested to see if the Neigong will improve the self-control of children with autism. Neigong is a type of Chinese mind-body exercise aims to improve the muscle, bones, internal circulation. It can also help to cultivate a peaceful and concentration mind. In this study, we have 46 children with ASD. We randomly assign half of them to learn Neigong and half of them learn the progressive muscle relaxation. As a result, those children who learned the Neigong saw a 23% improve on the test of mental flexibility, while the control saw only 12%. In terms of the temper outburst, the children who learned the Neigong improved 1.7 points, while those who are in the control group basically have no improvement. They improve 0.1 point. So it is suggesting to us that the children who have learned the Neigong has better control their temper and their behavior. In another study, we are interested to see the long-term effect of the Chanwuyi Lifestyle Medicine. 30 children participate in this study, and half received the training and half served at the control group for 6 months. So we have a p-test, and then half of the children learn and practice the Chanwuyi Lifestyle Medicine for 6 months, and then we have the post-assessment. After 6 months, children who have changed their lifestyle saw a significant improvement in their mental flexibility and less disinhibited. And we also conduct research on adults with depression. We have 75 patients with clinical depression and randomly assigned into receiving the Chanwuyi Lifestyle Medicine, the cognitive behavioral therapy, and on waitlist. The result of this study is quite encouraging. After 10 weeks, both the Chanwuyi Lifestyle Medicine and the CPT group show improved depressive mood, but more patients in the Chanwuyi Lifestyle Medicine group, about 35% of them, than the CPT group, which is 30%, or control group 0%, reduced the intake of antidepressant. I would like to emphasize that the antidepressant is given by the psychiatrists who are blinded to the study. So this result is very encouraging. For people who receive the CPT, which is a more traditional therapy for depression, and they receive the Chanwuyi Lifestyle Medicine, they both have their mood improved. But people in the Chanwuyi Lifestyle Medicine can reduce the intake of their antidepressant significantly more. We also have conducted some research on elderly with memory complaint. In one of the studies, we recruit the normal older adults who think that they have some memory problem. So the results show that older adults show about 10 to 50% improvement on their memory, with people with more severe memory problem at the baseline show more improvement. For instance, people are doing less well at the baseline, they show a 50% improvement, and those are doing well at the baseline, they show about 10% improvement. Besides, older adults also show improved physical health after 1 month. Participants show increased walking speed, their blood pressure are better. They also show significant reduction in perceived stress and sleep disturbances. So the encouraging result from the community draw samples lead us to another randomized control trial study. We have 56 older adults with memory complaint randomly assigned to receive the Chanwuyi Lifestyle Medicine and to receive the memory training. So the results show that elderly who received the Chanwuyi Lifestyle Medicine show improve on memory as well as those receive memory training. However, the Chanwuyi Lifestyle group as compared to the memory training group report better overall psychological health and physical health. So there's additional value to the Chanwuyi Lifestyle Medicine than improve the memory. The next question we want to ask is how long is the effect will last? After the intervention, will the effect sustain? So after the intervention, we wait for 18 months and then we do the assessment again. And what we find is that the effect of memory improvement has sustained after 18 months for both the Chanwuyi group and the memory training group. That is very good. Older adults in the Chanwuyi Lifestyle Medicine group report continue to apply the intervention in their daily living. 100% of them, all of them still practice Nei Gong. 91% of them still modify their diet. Overall report a greater level of improvement in overall physical health as compared to the memory training group. So the effect sustained after 18 months. So our research so far suggesting that the Chanwuyi Lifestyle Medicine program has shown to have a positive effect on improving the cognitive function, psychological function of children, adults, and older adults. It may be a very cost-effective way to reduce the problem associated with brain disorder. This is the end of the section. Thanks for your attention.